The average ER wait in Carson City is 52 minutes, but that's only half the story. Hey, I'm Joshua Priu, and of course I'm with Lisa Williams, my partner here at Berkshire Hathaway and the Lisa Williams A-Team. And thank you for joining us today. We're going to be talking about healthcare in Carson City. And if you're moving to Carson City, do this before you need a doctor. All right, let's start off by talking about urgent care versus ER in our area. And of course, there's three types of care when we consider kind of urgencies, right? Walk-in, urgent care, and of course the emergency room that you probably want to avoid if you can. But definitely some options here in Carson City for that. So Carson Tahoe Health offers lots of different care options, and they have walk-in clinics, and there's urgent care, of course, and then the emergency room at the hospital, which is located up in North Carson. But there is two competing urgent care systems here in Carson City, just so you know. Of course, there's the Carson Tahoe Health, but then there's also Renown, and Renown is a big time up in Reno, but they have urgent care and clinics here in our area as well. So just want to give you a heads up so you can go to either. And depending on your insurance, you might want to make a decision on which one is best for you. Of course, hours are going to vary by different locations here, but our local urgent care here in Carson is open from 8 a.m. to like 8 p.m. Every single day. And of course, the emergencies are open 24 hours a day, 7 days a week, 365 days a year. So I do want to talk about the billing quirks, though. This is really important because just in case you're coming to the Carson City area here, urgent care is operated by the hospital system. And so patients may receive two separate bills for a single visit in the urgent care. So you get one from the hospital, and then you can get one from the physician. So just kind of keep your mind open when you're kind of learning about the area, about what would be the best place to go. Also, definitely, where you live. You could be in South Carson and be as far as like 20 minutes away, and you have an urgent care 3 minutes away. Go there, right? But if you need the emergency room or some sort of elevated level of care, definitely up in North Carson is where the major hospital is in the emergency room.
So this is probably one of my favorite topics to talk about because, as many of you know, while I've been in the real estate industry for 18 years, I am a retired nurse. So our main hospital here is Carson Tahoe Health. They have 2 hospitals, an urgent care, and 21 regional locations. It's a big hospital. The main hospital here is 159 beds. And the main hospital has other services there. They have the ER, the cardiac, cancer, women's health, and children's health. It's one of the top rated in the area. I used to work there. I worked with a lot of seniors at the time. It was like senior mental health. It was one of my favorite jobs as a nurse in my whole nursing career. So it's a very good hospital, very, very good customer service. We're also affiliated with a couple of campuses in the area. So right here in Carson City, we have Western Nevada College, and they have a 2-year RN program that a lot of the students go through, and then they go right into nursing at Carson Tahoe as RNs. But also UNR is in Reno. That's a main university, University Nevada, Reno. And they have a whole medical department there for medical students and 4-year RNs, bachelor RN programs. So we get a lot of nurses coming through there for their education, and then they go straight to the 2 main hospitals. In Reno, it's Renown, and in Carson City, our main hospital is Carson Tahoe. I won't go into all the insurances, but one of the main insurances here, of course, we have Medicare, Medicaid, but Senior Care Plus is an up-and-coming insurance company here. A lot of my clients who've moved in from out of area, especially California, have settled into the Senior Care Plus health insurance program, and they are really happy with it. If you would like a little bit more detail on the health insurance available here. If you're coming from out of state, you can message us down below and we can email you the research that we've done on that to provide for our clients.
Now, something to consider if you're looking at different areas is ER or emergency room wait times. And it's not something that I would even consider. It's going to be a while, right? But I can imagine in bigger cities, if you're moving here from like San Francisco or something, those wait times could be probably pretty hectic if you're just there with, you're not bleeding to death or something like that. So something to consider. But yeah, I mean, it is 52 minutes for the wait time. So that's from arrival until you're actually seen by a doctor. And in my opinion, and maybe I'm crazy, maybe I'm wrong, maybe it's different where you live, but 52 minutes doesn't seem like all that bad to me. I've waited for much longer at the ER in San Jose with broken bones and other things. So, but that's the average wait time, of course, and we do everything in averages, right? You can be longer, it may be really super quick. But here's the thing, Carson Tahoe's ER volume is super high. For a small town, they have 40,000 to 60,000 visits every year. So that is a lot of people coming into that emergency room. And so the amount of wait time seems like they're doing a pretty darn good job. I have not had to go to the ER. Well, I guess real briefly, but my wife and I had our daughter there at Carson Tahoe Hospital, and we had to go into the ER because it was late at night when we went in at first. But other than that, I haven't really had any personal experience there, except for the care when we were there after the birth of my daughter was pretty exceptional. So with that 52 minutes, you're going to have about 3 hours before discharge, and could be as much as like 4 hours and 45 minutes if you needed to be admitted to another hospital. If you need some sort of specialty care, trauma, or something like that, it isn't handled by Carson Tahoe. So all something to consider. And the average time spent there at Carson Tahoe emergency room is about 3 hours and 2 minutes. And so, that's, again, doesn't seem like all that bad to me. Nobody wants to be at the hospital, but 3 hours is better than, 10, right? It is a little bit higher than the state average, 37 minutes longer than the average, total time at the hospital throughout the state. So a little bit slower here in Carson City. It may be because of where we're located. We get a lot of people from Washoe, maybe even the Carson Valley, Dayton, that are all going to that area, even though Carson City is relatively small. And it is higher than the national average also, 47 minutes higher than the national average. So a little bit slower than some places. But again, we talk about averages. I'm sure there's a lot of places across the country that take a hell of a lot longer than Carson City does.
So let's talk about access to mental health services here, which, by the way, was my field when I was a nurse and worked at Carson Tahoe. So it's near and dear to my heart, people's mental health. So there is a little bit of a regional shortage on mental health providers here in Carson City, and then especially as it moves out into the rural areas. But it doesn't mean they're short-staffed. It just means they pay more to hire travel nurses, which, by the way, could be a whole different topic of why you should own investment property in Carson City to accommodate those travel nurses who come through and are traveling. And there's also some independent care providers that fill in, and they have grouped together to try to fill the gaps of the mental health staffing shortages. I would say that there's some shortages in all areas of the hospital, and they use these agency companies to fill the gaps so that there's not a lack of service or medical treatment. They just have to use the traveling nurse system, which is a really big system. Crisis resources do exist, though. The Mallory Center here at the old hospital of Carson Tahoe handles a lot of that. And also there's a 988 line for local counseling. If you need just counseling services, there's a counseling service center. And just some practical tips, right? So when you first move here, you first get here, the most important thing to start with is to find a primary doctor right away. You can read reviews, you can ask people, you can ask my experience, and I know a lot of the doctors in town, but it's a lot of the medical people are still taking new patients, so they're open to new patients. Carson Medical Group is a big organization here, and they take a lot of new patients as the area continues to grow, right? And then also when you get here, you'll want to confirm your insurance network and your coverage before you actually need a hospital visit. So there are many, many companies that provide the coverage. And as I mentioned, Senior Care Plus is one of the big ones. Also, Kaiser is coming to Reno, and I suspect that over time that will spread into Carson City as well if you're used to using Kaiser. And so you should also know where the urgent cares are before you actually need a visit to the hospital. So I would check those out and know where they're located because they're all over. So know the urgent cares as backups. And then you'll want to budget extra time if you need to see a specialist. So the specialists, you need a referral for that usually, and it takes a little longer to get in with a specialist because they're usually a little bit more backed up. And the most important thing is when you get here, once you're settled in, save the crisis numbers that you may need for your particular health in advance. So you want to know the crisis numbers for the cardiac center, mental health center, whatever your issues are, you'll want to have the crisis numbers in your phone while you get on board with the insurances, the primary care provider, and learning where the facilities are.
All right, let's talk about specialists here in Carson City. So there's a lot of services that you can get right here in Carson. And, for the most part, you're pretty well covered. I mean, we have cardiology, cardiovascular, family medicine, internal medicine, endocrinology, neurology, oncology, psychiatry, and rheumatology, all right here locally in Carson City. But sometimes you need specialty appointments, and sometimes those are going to be up there in Reno. And so all those specialists that you need to go away from sometimes for like a 30-minute drive, up there in the Reno and Sparks area and stuff. Right here in Carson City, you can have neurology and cardiology, but they might have to refer you to some sort of specialist where your appointments are up in that area. And so this is very normal. I mean, of course, we're pretty rural. But it's not unusual. I know a lot of people, even my father, when he lived here in Carson City, had to do some of his appointments there in Reno. And I know a lot of people that go up to Reno for their specialty appointments. It's pretty normal, although you can get care here for a lot of those specialty fields. Sometimes the specialists themselves are in Reno. So just to, when you're kind of shopping the area and stuff, maybe find out where your appointments are going to be. And there are other options too. So we find that people get referred out a lot, and that we have three kind of major medical centers up in Reno and Sparks. We have Renown, St. Mary's, and Northern Nevada Medical Center. And so those ones are all, there and available if you need that like next tier up level of care. And so, most everything can be done here in Carson, but be prepared to actually have to take some trips to Reno every once in a while. I do find that trauma usually is taken care of in Reno. So if some emergency room broken bone, no problem. But if you had real serious trauma, then chances are Reno is going to be your spot as well. And finally, let me just kind of touch on all the specifics about our health facilities here. We're a pretty comprehensive healthcare network. We have 2 hospitals, 2 urgent cares, emergent care, and we actually have 21 regional locations. So if you're not right here in Carson City, all the surrounding areas are all kind of part of the same network. So Dayton and Yerington and Gardnerville, Minden, I mean, the whole area here is going to be all a little bit connected. So wherever you're at, you do have healthcare options nearby that are all connected to the same network. But right here, our North Carson, like major medical campus, is a 352,000 square foot facility. Pretty impressive on 80 acres. And of course, you're going to be surrounded by all kinds of like little specialty options too. There's several buildings all in that area for, different things, let's say orthopedic or family medicine or something like that. And one of the cool things about it is it's actually a really beautiful hospital, just the setting alone, but just the building and everything itself. In fact, in 2014, it was named number 5th the fifth most beautiful hospital in America. So I don't think we gotten that rating recently, but it is really kind of a beautiful spot there. So let me get down to the nitty gritty. We have 159 acute care beds, 153 private rooms, of course, 24-hour, emergency medical, advanced medical imaging is right there. You even have open heart surgery, cardiovascular. I mean, the list kind of goes on and on. So there's, very good services locally here.
Thank you for watching. Again, I'm Lisa Williams. Like, subscribe, send us a question, or call us directly if you just want to chat.